the most likely thing I'm going to get when I travel is actually, that is the highest infectivity rate we have with any disease known to man. Hello everyone, and thank you for checking us out. This is SAC Health Answers, the video series where we answer your questions about health and wellness to give you the knowledge for you to make the best decisions for your health. I'm Dr. Jason Lohr. I'm the CEO here at SAC Health, but I'm also a practicing family medicine physician. And a question I get regularly from my patients, especially those who may be traveling, is what kind of travel vaccines do I need? That's a great question. In fact, many people think, I'm going to travel, I need to get some exotic vaccine, right? These vaccines that are specifically related to travel, things maybe you've heard about, like things like yellow fever vaccine or Japanese encephalitis vaccine. But I really want to focus, what's most important when you travel is actually routine vaccines, your regular vaccines. In fact, do you know what the #1 vaccine preventable disease in travelers is? It's the flu. The flu shot. Nobody would think that the most likely thing I'm going to get when I travel is actually the flu. But that's super important because if you have your routine vaccines, that's going to keep you as healthy as possible when you travel. Remember also with the flu vaccine that if you're traveling to the southern hemisphere, that's south of the equator, the flu season is opposite than what it is here in the northern hemisphere, north of the equator. So you may be traveling down there during the summer, our summer, it would actually be winter, and you would need the flu shot in order to protect you. So I always recommend anyone who regularly travels, get your flu shot every year, because you don't know when you're going to necessarily need to travel and when the flu season will be occurring in the place you're traveling. The other routine vaccine that's important is measles. Measles is actually the most infectious disease that exists. If there were 10 people in a room and one person had measles, they would infect the other 9 people. 90% of people being exposed to measles will actually come down with the disease. 90%. That is the highest infectivity rate we have with any disease known to man. So measles being super infectious is super important to get that vaccine and be up to date on that vaccine before you travel. The other thing is chickenpox. In fact, the only cases of chickenpox that I've seen in this country were actual travelers, international travelers, who were actually visiting the US. And when they were in the US, they actually broke out with chickenpox because they weren't vaccinated for chickenpox in their own country. They got chickenpox here. Those have been the only cases I've seen. So realize that when you travel, you can get exposed because other countries do not vaccinate as much as we do when it comes to chickenpox. And then don't forget the tetanus shot. Remember, you never know what you're going to be exposed to. Tetanus shots are good every 10 years. If you get exposed to something when you're traveling, you step on a nail, you get cut by anything that's metallic, or even you get dirt into a wound when you're traveling, that can increase your risk for developing tetanus. And you may not be close to like a clinic or a hospital when you're traveling to get a booster tetanus shot. So make sure you're up to date with your tetanus before traveling. Again, I know my focus right now is just on routine vaccines. There are also travel-related vaccines, but remember, the routine vaccines are more important than even travel vaccines when you're traveling. So make sure you're up to date on all of those. And remember, most insurances cover all routine vaccines, very little cost or no cost out of pocket. So important to remember. Thank you for joining us for this episode of SAC Health Answers. Remember, your primary care doctor is your partner in your personal health and wellness. So connect with them with any questions you may have, and we'll see you on our next episode of SAC Health Answers.